First, well, we all saw the news yesterday where the King has been diagnosed with cancer. We're joined now by our royal editor, Camilla Tominey, royal biographer Robert Hardman and cancer specialist Karol Sikora, and Dr Zoe as well with all the latest. Camilla, let's start with you. We saw you yesterday here. So normally, you know, you sort of give us a bit of a heads up on stories. Yeah. So when did you find out what you found out?
We knew something was afoot after I left the studio yesterday in the afternoon. There was sort of talk that there was going to be a major announcement at around 6 p.m. In that kind of event, you do have the newspapers sort of slightly being given a heads up just to prepare, because in these days, 24-hour rolling news, one wants to get the news out there online as quickly and as accurately as possible. So they do give us a little bit of prep. But, of course, it's the news that we didn't expect to hear, because when the King went in to have his enlarged prostate dealt with last week, we were told by Buckingham Palace at the time that it was non-cancerous. And now what appears to have happened, and Dr Karol, of course, will give far more detail on how this may have emerged in this procedure, but they've discovered a form of cancer. They haven't said what form of cancer that is. They've said that the King is now undergoing a schedule of therapy as an outpatient, that they are saying that he will continue with affairs of state, so his red boxes, that official paperwork he goes through every day.
He still wants to do that?
He still wants to do that. In fact, there may even be the chance that he can carry out some engagements with regard to perhaps his privy councillors, that he will see Rishi Sunak every week if he is well enough.
Behind the closed-door stuff, basically.
But behind closed doors, what he's not going to be doing for the foreseeable future is that public-facing role. Obviously, that will knock him for six, because we know he's a renowned workaholic. We know, like his mother and his grandparents before him, he wants to be seen, to be believed, and he wants to be pressing the flesh, but he's obviously not going to be able to do that. So, look, at one hand, a 75-year-old man being diagnosed with cancer perhaps isn't a shock, but it is a shock for us when we know the King to be in robust health. You know, he eats well, he doesn't really drink very heavily. His family history is one of longevity. So, of course, it's a shock. And he's only at the beginning of the Carolian era. So they've had a difficult few years, the Royals, and now this.
And Dr Karol, obviously, we knew about the prostate situation. How would this have come about? How would they have spotted this cancer?
So the most likely thing is something happened during the procedure to alert them that he had a cancer somewhere. We're told it's not prostate cancer, which is the most likely thing, first thing I thought of. So it's got to be somewhere in that area. Bladder would be the next prevalent type of cancer in someone of that age, but it could be something unusual. You know, he had the operation. It was an operation for a benignly enlarged prostate, very common in everybody, all men over 70. So it's likely that when they put the tube in to do the operation, they looked in the bladder and found an area that was abnormal. That was biopsied. Takes a delay to get the pathology result. Even for the King, it still takes a week to get the results back because of the special tests that have to be done. And that's come back, and now they're treating it appropriately with regular treatments, either chemotherapy into the bladder or radiotherapy. That's what it sounds like.
But he's an outpatient. Would that suggest it's not that serious, or is this going to be serious?
You know, most cancers treated as an outpatient, other than surgery. Surgery you need to be in hospital for the anaesthetic and so on, and intensive care if necessary. But all cancer patients are now used to just parking their car, having treatment, getting out. There's no quick fixes for cancer. You can't come into a shiny building, one door, and go out the back cured. You have to come back regularly, regular tests. And, of course, the most important thing, and he may well be lucky here, is the cancer was picked up early. We've got to try and learn how to do that early, and it's one of the problems in the NHS at the moment.
And, obviously, we know that the Palace has not said what cancer it is, but of a man of his age, what would be the most common cancer that a man of that age would be going through? So, prostate and bladder, we're told it's not prostate, so it's most likely to be bladder. The other things, they could have found a little lymph node down there, which they've biopsied and found it's got cancer from somewhere. Or it could be something totally different, but that seems unlikely, because if it had been cancer elsewhere, that would have taken priority over the prostate. They'd have treated that first before going to the prostate. So, a lot of unexplained questions.
Robert, let's bring you in. Obviously, health is such a sort of private matter, but obviously he's the monarch, so there has to be, and Camilla, I love your take on this, there's got to be a degree of kind of public exposure to this as well. Do you think that's very much come from him in terms of knowing the man? Do you think that's kind of come from him in terms of how he wants this to be put out there?
Yeah, I think we saw from really the get-go, from the moment he became king, there was a shift in the regal approach to communication. He's very much more, he's very comfortable in crowds. We saw that the day after the Queen's death. He was straight down into the crowds in London. He was onto the airwaves. When the Queen became Queen, it was 10 months. The late Queen became Queen. It was 10 months before we heard her say anything. We've seen it time and again, this comfort. He's comfortable with the idea of communication because he's of that generation. I mean, he's someone who's comfortable giving interviews. I mean, I've interviewed him many times over the years, made a TV programme with him. That's something the late Queen didn't do because he's, as I say, he's of a younger generation. And I did think it was remarkable a couple of weeks ago when you saw those words, enlarged prostate, in a palace bulletin. I mean, you never sort of saw that sort of language before. And I think people will say, well, he was that open about that. Why can't we know what it is he's got now? I think probably, and Karol would be far better placed to discuss this, but I think all patients, you want to hold something back. You don't want to put it all out there. The palace operates on precedent. I think if they started telling us everything now, we would then expect everything at every stage. That's not going to happen. When we need to know something, we'll know. But I think for now, what we're looking at, actually, you just want to rewind a few years to where we were at the start of the COVID pandemic, when everyone thought, how is this institution going to be able to cope? This institution that relies on interface with the public, surely it's in trouble. And actually, the monarchy, I thought, had it came very quickly to a practical way of dealing with it. So I think we'll see a lot more of that, the sort of the Zoom-type engagements. We might even hear actually a bit more. We might see more of his audiences. And we just won't see him out and about.
Given you've spent so much time with him, when you see him on a day-to-day basis, he seems like a man of pretty robust health. And he seemed, the stuff that I remember reading the papers when I was a kid and the editorial kind of laughing at the tree hugging and so forth. He seems to have embraced that kind of organic, holistic lifestyle a long time ago, which we know is beneficial for us.
Yeah, he leads an abstemious life. I mean, for example, he doesn't eat lunch.
Doesn't eat lunch?
Nope, he doesn't do lunch. Even though Queen Camilla is patron of a charity called the Big Lunch, the King doesn't even do the small one.
Of those.
He likes to go from breakfast through to tea time. He doesn't drink much. What he does eat is very healthy. He is as fit as a fiddle. I mean, I've spent the last year following him around both my book and a documentary, and watching him striding off, whether it's on an engagement or a walk in the Highlands, he is a fit man. And obviously he won't like some of the constraints that this is going to put on him. But at the same time, he's got to be well placed. He's been doing a thing called Royal Canadian Air Force exercises ever since he was a young man. He has a sort of fitness regime. He's in as good shape as I think a 75-year-old could hope to be.
Which, Karol, you would hope, therefore, would bode well in terms of if you're going into that. Well, I remember when my dad had a bypass, he was 76, and the doctor just said, you're a great fit 76-year-old, that will certainly help you, and is now in pretty rude health. So that kind of going into that kind of procedure with good health is so important.
Absolutely. It's 75 is the new 50,
yeah.
I think. And there's no doubt that people in their 70s today in Britain are much fitter than they were 20 years ago. And there's reasons for that. I mean, King Charles looks great, he's slim, he obviously, as we've heard, does a lot of exercise. I'm sure his diet's very healthy. And, that all helps with cancer. Diet and exercise are two of the things that are forgotten about after you've had cancer treatment. Healthy diet and lots of exercise. Even a randomised trial has now shown that exercise is a benefit for cancer patients in terms of survival. So I think he's going to do very well. I'm not very gloomy about the prognosis. I'd say it's good.
And Camilla, we know that Harry is coming back to the UK. What do we know so far about that?
So we understand that Harry was informed of the diagnosis along with William ahead of the public finding out, as one would expect. It's no secret that there hasn't been very much contact between Harry and William, certainly since Spare was published. We don't think they really exchanged many words even at the late Queen's funeral. There has been apparently a warm conversation between Harry and his father for his father's 75th birthday, which was last November. Obviously, it does kind of raise the spectre of the possibility of a royal reconciliation. I mean, at the end of the day, these once close brothers love their darling papa, as they call him, very much indeed. He's the only parent they both have left, and one would hope, for the King's sake, that they can come together. I mean, obviously this is desperately sad news. It's only right that Harry wants to be here by his father's side to support him through it. Difficult timing for William, though. I mean, let's be honest, the Princess of Wales has only just come out of the London clinic herself for that abdominal surgery. She spent 13 days in hospital, which means that it's not an insignificant procedure for her. William had said, with his father's blessing, actually, I want to prioritise immediate family, look after Kate and the children while she recovers.
Yeah.
Cool.
He's now going to be required to step up to the plate and fill the gap a little bit for his father. So he's perhaps, like many of his generation, you know, caught between having quite young children, having elderly parents with health problems, having to look after his wife. But as heir to the throne, constitutionally, he's the liege man of life and limb. Of course, Queen Camilla plays a role. But when it comes for instance, standing in at investitures, standing in at audiences with the Prime Minister and all the rest of it, that will be a role for William and not for Camilla. So Camilla will carry on engagements, and indeed other royals like Princess Anne and Prince Edward will all step up to the plate. But of course, the pressure now is on William to be his father's sort of most stalwart supporter.
Let's look at this in a wider context of cancer. Zoe, thanks for joining us over there. I feel like you're out on a limb. Sorry.
Hi, everyone.
Not enough room in the inn over here. I mean, when King Charles went for his prostate operation, like the pick-up on awareness there has been extraordinary, hasn't it?
It really has. And, you know, we know that King Charles does not have prostate cancer, but the Prostate Cancer UK saw a 500% increase in people visiting their website. And I think the cancer charities have been so grateful to him for being so open and sharing with all of us that he's going through this. He's actually a patron of Macmillan Cancer Support. And I think, actually, Dr Jay Verma, who's president of the GP section of the Royal Society of Medicine, is what he said is kind of, I think, what a lot of us healthcare professionals emulate. He said, we would like to thank His Majesty for using his unique position in highlighting how cancer is indiscriminate in who it affects and that there should be no shame or embarrassment in coming forward to seek help and advice. We know that, especially amongst certain communities and cultures, there's still a lot of stigma around cancer, and that often delays people coming forward or having conversations with their families. So, you know, I really hope this will help people who are experiencing that to not delay, come forward, seek help if you've got any signs that you think could be cancer.
Dr Zoe, there has been concerns about Prince Charles's hands. They're quite swollen, aren't they? What does that tend to normally mean?
I mean, it can be a sign of ill health, but I think with King Charles, you know, it's been identified that he can have these swollen fingers for decades now, and we know that actually for a man of 75, apart from, you know, this recent diagnosis, he's in exceptionally good health. So I don't think we need to read into those fingers too much.
OK.
Yeah. Thank you all.
Thank you
so much.
Karol, Camilla. Thank you, Dr Zoe.
Thank you.
It's good to have you with us. Good insight. Thanks, guys. Coming up